What if I told you that some of the most ordinary things you do every single day, habits so routine you never think twice about them, could be quietly destroying your kidneys? That might sound dramatic, but here is the truth. Your kidneys are two of the hardest working organs in your entire body. Every single minute of every single day, they are filtering toxins out of your blood, regulating your body's fluid levels, and keeping your blood pressure stable. They never stop, they never rest, and most people never give them a second thought until something goes seriously wrong. The problem is that certain daily habits, things most of us consider completely harmless, are placing enormous and unnecessary strain on these vital organs. And the damage builds slowly and silently, often without any obvious warning signs, until the consequences become very difficult to reverse. Today we are going to count down the 10 daily behaviors that could be quietly sabotaging your kidney health. From number 10 all the way down to number 1, where we will reveal the single most damaging habit of all. These are not minor inconveniences. These are patterns that genuinely increase your risk of chronic kidney disease. And if any of them sound familiar, it is time to make a change. Stay with us until the end, because every single one of these matters. Starting at number 10, we have something that virtually everyone does at some point, sometimes every single day. Holding in your urine. We have all been there. You are deep in the middle of something at work, stuck in traffic, or just too absorbed in what you are doing to get up and go to the bathroom. So you wait, and then you wait a little longer. It feels harmless, but when this becomes a regular habit, the consequences start to add up. When you consistently ignore the urge to urinate, you are placing ongoing stress on your bladder. Over time, this can cause the bladder to stretch beyond its normal capacity, or lead to weakened bladder muscles that are no longer able to empty completely. Incomplete bladder emptying creates exactly the environment that bacteria need to grow and multiply, significantly raising your risk of urinary tract infections. And here is where it becomes a kidney problem. If those infections are left untreated or continue to occur, the bacteria can travel upward from the bladder into the kidneys and cause a serious kidney infection that can do real and lasting damage. There is also the issue of kidney stones. When urine sits in the bladder for too long, the minerals it contains have more time to crystallize and form stones, which are not only extremely painful but can cause long-term harm to kidney tissue. The simple fix is to listen to your body. When you feel the urge, go. Your kidneys will thank you for it. Coming in at number 9 is something that millions of people do without a second thought every time they feel a headache, a sore back, or any kind of ache or pain. Misusing painkillers. Non-steroidal anti-inflammatory drugs, the kind you find at any pharmacy under names like ibuprofen, aspirin, and naproxen, are among the most commonly used medications in the world. And they work. They bring down inflammation and ease pain quickly and effectively. The problem comes when they are used too frequently, too casually, or for too long. These medications work in part by reducing blood flow to the kidneys. In the short term and used occasionally, this is not a serious concern for most healthy people. But when you are reaching for them regularly, that reduction in blood flow becomes a chronic problem. The kidneys begin to suffer from what is called analgesic nephropathy, a form of kidney injury that develops gradually and can lead to permanent, irreversible loss of kidney function. Chronic kidney disease can result, and unlike many other conditions, the damage done to kidneys through long-term painkiller misuse is very often not recoverable. If you find yourself relying on pain relief medication on a regular basis, that is a sign worth paying attention to. Speak with your healthcare provider about finding safer alternatives or investigating what might be causing the underlying pain. Your kidneys should not be the price you pay for managing discomfort. Number 8 is one that is both incredibly common and incredibly underestimated. Not drinking enough water. Water is not optional for your kidneys. It is the very substance they depend on to do their job. Your kidneys filter waste and excess substances out of your blood and flush them out of the body through urine. Without adequate water, that process breaks down. Waste starts to accumulate. Urine becomes more concentrated, which irritates the kidney tissue and creates the conditions in which kidney stones form. Kidney stones are dense, hard clusters of minerals and salts that cause some of the most intense pain a person can experience and can cause serious damage to the kidneys as they pass through the urinary tract. And beyond stones, persistent dehydration over months and years leads to a gradual and progressive decline in overall kidney function. The kidneys simply cannot perform efficiently when they are constantly working with insufficient fluid. The general recommendation is to aim for at least 8 glasses of water a day, though your individual needs will vary depending on your activity level, your climate, and your overall health. Keeping a water bottle with you throughout the day, and making hydration a conscious habit is one of the simplest and most powerful things you can do to protect your kidney health over the long term. Number 7 is one that most people know is not ideal but underestimate just how seriously it affects the kidneys. Eating too much salt. Sodium is found in almost everything, and in moderate amounts it plays an important role in fluid balance, nerve function, and muscle contraction. But when you are consistently consuming far more sodium than your body needs, as most people who eat a typical modern diet are, your kidneys are forced to work significantly harder to remove the excess from your blood. That extra workload, sustained day after day and year after year, gradually wears down kidney function. Excess salt also causes your body to retain fluid, which increases blood volume and drives up blood pressure. An elevated blood pressure is one of the most damaging forces your kidneys can be exposed to. It physically strains the delicate blood vessels inside the kidney tissue, reducing their ability to filter effectively and accelerating the development of chronic kidney disease. High sodium intake also increases the concentration of certain minerals in urine, raising the risk of kidney stone formation. The biggest sources of hidden sodium in most people's diets are processed and fast foods, not the salt shaker on the table. Reading labels, choosing fresh foods over packaged ones, and using herbs, spices, and lemon juice to flavor your instead of salt are all practical steps that can make a real difference to your kidneys over time. Number 6 is closely connected to what we just discussed, and it is one of the most widespread dietary habits in the modern world: eating processed foods regularly. Processed foods are convenient, they are often very palatable, and they save time. But what they contain is a list of ingredients that are genuinely harmful to kidney health when consumed on a consistent basis: high levels of sodium, refined sugar, poor quality fats, and a range of chemical preservatives and additives that your body has to work hard to process and eliminate. The sodium alone is enough to raise blood pressure and damage kidney vessels over time. But the picture gets worse. Many processed foods are highly acidic in their effect on the body, and your kidneys are responsible for maintaining the body's pH balance. When your diet consistently pushes toward acidity, your kidneys are under constant pressure to decompensate. On top of that, diets high in processed foods are strongly associated with weight gain and obesity, which raise the risk of both diabetes and high blood pressure, the two leading causes of kidney disease in the world. Shifting your diet toward whole, unprocessed foods, fresh vegetables, fruits, whole grains, lean proteins, and healthy fats is one of the most meaningful things you can do, not just for your kidneys but for your overall health. Cooking at home from fresh ingredients, even just a few times a week, gives your kidneys the nutritional support they need to keep functioning the way they should. Number 5 is a condition that affects hundreds of millions of people worldwide and destroys kidney health, so gradually and quietly that most people do not realize what is happening until the damage is already severe. Ignoring high blood pressure. High blood pressure has earned the nickname the silent killer for a very good reason. It rarely causes noticeable symptoms. You have dangerously elevated blood pressure for years and feel completely fine, while the entire time the excess force is damaging the blood vessels throughout your body, including the intricate network of tiny vessels inside your kidneys that are responsible for filtering your blood. When those vessels are damaged by sustained high pressure, their filtering capacity declines. The kidneys become progressively less able to remove waste and excess fluid from the blood, a condition called hypertensive nephropathy. Left unchecked, this leads to chronic kidney disease and eventually to kidney failure, at which point the only options are dialysis or a kidney transplant. Controlling your blood pressure through a low-sodium diet, regular physical activity, stress management, limiting alcohol, and medication when prescribed by your doctor is not just about protecting your heart. It is absolutely critical for protecting your kidneys. Check your blood pressure regularly, know your numbers, and TRLE if they are consistently elevated. Number 4 is hiding in plain sight in almost every processed food, every sweetened drink, and countless condiments and sauces that people use every day without reading the label. Consuming too much sugar. Most people associate excessive sugar with weight gain and tooth decay and stop there. But the damage sugar does to the kidneys is serious, progressive, and in many cases permanent. When you regularly consume large amounts of sugar, your risk of developing type 2 diabetes rises dramatically. And once blood sugar levels are chronically elevated, the small, delicate blood vessels inside the kidneys begin to sustain damage. This condition, known as diabetic nephropathy, is the single leading cause of kidney failure in the world. Beyond diabetes, excess sugar contributes to obesity, which independently strains the kidneys by increasing the amount of work they must do to filter a larger blood volume and maintain the body's fluid and electrolyte balance. Sugar is also a significant contributor to high blood pressure, which, as we just discussed, is itself one of the most destructive forces a kidney can face. Start reading food labels and pay attention to added sugars in drinks, condiments, and packaged snacks. Choose whole fruits when you want something sweet, and use spices like cinnamon or vanilla to add flavor without adding sugar. Your kidneys, your blood sugar levels, and your overall health will all benefit significantly. Number 3 is one that most people already know is harmful, but the extent to which it damages the kidneys is something far fewer people fully appreciate: smoking. The connection between smoking and lung cancer is well understood. The connection between smoking and heart disease is well known. But smoking and kidney disease is a relationship that does not get nearly enough attention, despite the fact that the damage is just as real. When you smoke, the toxic chemicals in cigarette smoke enter your bloodstream and circulate throughout your entire body, including through your kidneys. These chemicals trigger inflammation and directly damage the blood vessels inside kidney tissue, reducing the kidney's ability to filter blood efficiently. Smoking also restricts circulation to the kidneys, compounding the damage and further impairing their function. Long-term smokers face a significantly elevated risk of developing chronic kidney disease, and smoking also substantially increases the risk of kidney cancer. What makes this particularly dangerous is that smoking simultaneously worsens two of the most important risk factors for kidney disease: high blood pressure and diabetes, making the combination exponentially more harmful. The encouraging news is that quitting smoking begins to improve circulation within weeks, and the reduction in kidney stress and risk begins almost immediately. If you smoke, reaching out for support to quit is one of the most powerful things you can do for your kidney health. Number 2 is something that many people engage in socially, casually, and in many cases daily, without considering what it is doing to their kidneys in the long run: drinking too much alcohol. Your kidneys are responsible for filtering everything that enters your bloodstream, and alcohol is a toxin. When you drink excessively, your kidneys are working in overdrive to process and remove it from your blood. This effort causes significant dehydration because alcohol suppresses the hormone that tells your body to retain fluid, meaning your kidneys are simultaneously being overworked and starved of the water they need to function properly. Reduced hydration means reduced blood flow to the kidneys, which impairs their ability to filter waste and maintain the body's fluid and electrolyte balance. Long-term heavy drinking also damages the liver, and the liver and kidneys work closely together in the body's detoxification system. When liver function declines, the kidneys are forced to compensate, accelerating their own decline. Chronic excessive alcohol use also raises blood pressure significantly, adding yet another major risk factor for kidney disease to the mix. Over time, this pattern can result in what is called alcohol-induced kidney disease, a serious and progressive condition that can ultimately lead to kidney failure. The general guidance is no more than 1 drink per day for women and 2 for men. If staying within those limits is difficult, speaking with a healthcare professional or connecting with a support group is a meaningful step worth taking. And finally, at number 1, the single habit that poses the greatest threat to kidney health of all: neglecting diabetes care. Of all the conditions that damage kidneys, diabetes is the most destructive. It is the leading cause of chronic kidney disease and kidney failure worldwide, and the mechanism of that damage is relentless. When blood sugar levels remain elevated over time, the small inside the kidneys sustain progressive injury. These are the vessels that do the actual work of filtering your blood, and as they are damaged, they become less and less capable of doing their job. Waste accumulates, fluid builds up in the wrong places, and kidney function declines. This condition, diabetic nephropathy, develops gradually and without obvious symptoms for a long time. By the time it becomes noticeable, significant and often irreversible damage has already occurred. End-stage kidney disease requiring dialysis or transplant is the final destination of unmanaged diabetic kidney damage, and it is a destination that proper diabetes management can very often prevent. Managing diabetes effectively means checking your blood sugar consistently, following a diet designed to keep glucose levels stable, exercising regularly, taking any prescribed medication exactly as directed, and working closely with your healthcare team. It also means managing blood pressure and cancerol at the same time, because all 3 of these conditions interact with and amplify each other's damage to the kidneys. If you have diabetes, your kidney health depends on how seriously you take your daily management. There is no single habit that matters more to your long-term kidney function than this one. And there you have it. 10 daily habits that could be silently and steadily compromising your kidney health, from holding in your urine all the way to the number 1 most damaging pattern of all. The good news in all of this is that recognizing these risks gives you real power to do something about them. Your kidneys are remarkably resilient when they are given the right conditions to function, and many of the changes that protect them most are not complicated or expensive. They are simply about awareness and consistency. Your kidneys work for you every moment of your life. Taking care of them is one of the most valuable investments you can make in your long-term health. Quality of life. If this video was helpful to you today, please like it. Share it with someone who needs to hear it, and subscribe to this channel for more practical, evidence-based health information. Stay informed, stay proactive, and we will see you in the next one.